Hi, we're from Coping with Cancer in Leicestershire and Rutland. We just wanted to talk to you about our services that we offer within Leicestershire and Rutland. We do support anyone affected by cancer practically and emotionally, so if you do feel that that may be you, then please do get in touch. We do have a Facebook page if you want to check us out on there, and also I hope you find the video useful for either yourself or for somebody you know. You can contact us on 0116 223 0055, or you can see more information at www.c-w-c.org.uk.
Danielle and Nisha have come in today from Coping with Cancer. Coping with Cancer is a really valuable local resource we have in Leicestershire and Rutland, which I know from my patients is a really significant benefit to them. And I'm really grateful for you to be here and describe to the viewers on the Cancer Stories programme what you actually offer. So what is Coping with Cancer and how's it developed?
Okay, so Coping with Cancer, it initially started off as a self-help group in people's homes. Demand for it kind of grew within the city, and then they relocated to our current premises, which is Helen Webb House, we're off Wesley Road, in 1999. And then in 2000, the premises was donated to us by Helen Webb's dad, John Rumble, who's on our board of trustees. His daughter Helen Webb, she was going through a cancer diagnosis herself at the time. Unfortunately, she lost kind of her battle, and in her memory, her parents set up a trust, and then the two charities kind of joined together. And that's where kind of the history lies of Coping with Cancer. So we've been there for about 34 years now. It'll be our 35th anniversary next year. And
how many staff do you have out of interest?
We have about 12 paid members of staff, and we have about 120 volunteers that help and support us.
That's impressive.
Yeah.
So let's come on to what you actually offer. And I'm going to ask Danielle this question of what resources you have, what can patients access? Okay. What's available to them?
Okay, so predominantly Coping with Cancer provides practical and emotional support to anyone affected by cancer within our catchment area of Leicestershire and Rutland, be it a patient, a carer, family, or friends. We offer a whole wide range of services, and one of our most popular services is our counselling service. We know that it's important for people affected by cancer to support their emotional needs, and our counselling service is one way that we can help support this, and it's something that, you know, we're there to listen to people via counselling. We also offer an extensive range of complementary therapies, including Indian head massage, reflexology, aromatherapy massage, and Reiki. These are usually done by our complementary therapy staff or from one of our 50 volunteers. And these can be done on a one-to-one basis, or they can be at one of our outreach groups across Leicestershire and Rutland. With the complementary therapies, they help people come to terms with what they're going through. They can help to help people deal with stress and anxiety, and also can help them to deal with some of the symptoms from treatments, so such as pain, poor appetite, sleeplessness, and things like that. We also run a solicitor's surgery, and this is working with local solicitors, and they can help with legal advice and legal issues, and they also help with the drawing up of wills. We also offer a befriending service. Our befriending service is a home visiting service where people can get one-to-one support. This helps people that may feel isolated, and it's a way that people have a listening ear to, and they can talk about any issues and concerns. It also helps carers to pop out to the shops and have a little bit of time for themselves. We also run a variety of support groups, and these are either based at Helen Webb House or out in the community. And the support groups are there to offer emotional support and also information, again, to patients, carers, family, friends, whoever basically may need some support. And within the support groups. We offer a whole wide range of activities and have motivational speakers in. They do arts and crafts. They do a whole wide range of topics.
So that sounds like a really brilliant list of resources, options if you like. So how, if a patient's coming in to see you, do they choose between those? Because there's quite a lot on offer.
We, in order for someone to refer themselves to us, anyone can refer themselves. We have an open door policy, so it may be they refer themselves, it may be referred from a family member or from a healthcare professional. Once people refer themselves into us at Coping with Cancer, we initially take a few details from them just to give us a background. Following this, one of our assessment officers will go out and visit the client either at home, or they may come into Helen Webb House, anywhere that they feel is a safe environment for them. Sometimes the home environment is quite stressful and they may not feel as safe and as open to talk to us about that. Once the assessment officers have their appointments with the clients, they will use a client information pack that goes through our services in quite a lot of detail, and the assessment officer can help to identify which would be the most appropriate services for the support that they needed. Our assessment officers often are told that it's the first time that patients feel that somebody has actually listened to them in a non-medical environment.
Sure, yeah.
And you know, they remind individuals that the feelings that they may be feeling are quite normal, and they're not alone in feeling like this. And also the assessment officers can read between the lines to help identify people with something that they may see things that they may not have seen themselves.
Definitely.
And also they can discuss any issues and concerns, and also signpost to other organisations and services that we may not be able to help offer with them.
Okay, so there's a really valuable initial assessment process which the assessment officer does, and then they decide which services are best suited for that patient in discussion with the patient.
Yeah.
Nisha, what's your overall impression then of how much patients benefit from a variety of services? Do you see the change in patients? I mean, what's your impression of how much good you're doing out there?
I think our patients get a lot from our services. I mean, our services are not time limited, so patients or family members or whoever's affected by the diagnosis, they can get it from day one until however long is needed, until they feel as though they're ready to kind of go out there again by themselves.
That's good. So there's no restriction on time?
No.
So they can come as long as they need in order to improve in a way?
Yeah.
And how long is that typically? How long do you hold on to somebody for? How long do they keep coming back for? Is that something you have any information on?
I mean, some of our clients, they're with us for about a month and they feel as though they've got as much as they need from it. Some clients, they're with us for over 3, 4, 5 years. So again, there's no time kind of frame. It's just, I guess, each individual circumstance is kind of quite unique.
Danielle, I'm going to come back to you and ask you about the difference between some of these options that are available. Some people will be familiar with some of them, like the counselling model, but who is it that does the counselling? Who is likely to be providing it?
Okay, we do have one full-time paid counsellor and also a part-time counsellor. The rest of our counsellors are actually volunteers, and we have over 60 volunteers. All are trained with appropriate qualifications within the counselling
model. The counselling
yeah.
model, yeah. And what's your impression of how popular that is as opposed to maybe holistic and complementary treatments?
I think the counselling in terms of emotional support is probably the most popular service, but also the complementary therapies is really popular as well. I don't think that there's one more popular than the other. I think it depends again on the individual circumstance and what they're looking for. We do often have, say, families that go through counselling as a whole rather than on an individual basis. They may have a family counselling session together to help them through the whole family.
Now, you've listed something here which I didn't know you offered, which is befriending, potentially out of your centre. So that's either in the community at the patient's home, I'm guessing.
Yes.
How does that work, befriending? Because it's something that we'd like to develop ourselves in terms of services that we run through the hospital. But I'm intrigued to know how you organise it.
Okay, so when we get a client through who we think they may benefit from a befriender. We set up a meeting with our pool of befrienders to see if anyone can initially, on a 1 month basis, kind of befriend them. That would mean going either to their home or them coming to our centre to do an introduction. And then kind of the boundaries are explained in terms of what the befriender will do and what the befriender won't do. So that's clearly explained, and then an agreement is drawn up with the conversation that we've had. Once they've both agreed, and it's organised, so say a befriender will come on a Thursday morning for 2 hours. Myself as the HR officer and the volunteer kind of coordinator for the centre, we just kind of keep in contact just to see how they're getting on. So befriending could range from like a various number of activities. So it could be just going around for a chat, having a drink, or taking them shopping, or taking them to appointments. So it's not limited to what they can and can't do.
Is the befriender typically a past cancer patient, or is it a volunteer from kind of any background who just wants to give something back to the community?
It's both. It could be. Some of our befrienders, they do have like experiences of a diagnosis, and some just want to give something back to the community. So it's open to anyone. Okay.
I mean, sometimes those little things like taking somebody out for a walk, going for tea, coffee, little things can mean a lot to patients sometimes, particularly patients who are otherwise isolated and feel on their own. So I'm sure that befriending service is very, very, very valued by patients. Now, you also offer some specific financial advice, I think, in terms of the solicitor's surgery. How does that work?
Basically, if someone wants some support around legal issues or advice, we will put their person in contact with the local solicitors, and we will arrange a consultation meeting. From the consultation meeting, then they can discuss sort of their concerns and issues and sort of where they can go from there, and then it will be up to the solicitors to help with that support.
So in a sense, you kind of signpost them, or do you actually host the solicitor's surgery?
The solicitor surgery actually takes place, I think the initial consultation actually takes place over the phone.
Yeah.
It does.
Free 30-minute consultation over the phone. And then the solicitor would do any kind of additional, what's the word?
Additional input, problem solving that the patient needs on legal issues.
Yeah, any additional services, it would be at a subsidised cost to the client.
Now, that's something that you don't find everywhere, and I know is definitely valuable. In the hospital, we used to have specific financial advice clinics, and then Macmillan have readopted those and provide that. So I could think of those things as kind of complementary in a way, the legal advice and the financial advice. So that would definitely be a benefit. When I think of your service, however, I think of perhaps the support groups for specific cancer types as like the backbone of the service. I don't know whether you think of it that way, but I'm just reflecting on what patients tell me. So how's that grown up with time? And do you see yourself as catering to all cancer types, all stages?
So in terms of our support groups, we have a massive range in terms of specific cancers and some generic in terms of women's group, men's group. We have the Friday Friends and the Feel Good Friday. We see it as the backbone of pulmonary cancer, and we're always trying to kind of develop them so that they're more interactive. People are getting a lot more from the support group, so it's not just like sit around the table and have tea and have a chat. We want them to take something away from like coming to our centre and for a meeting.
Yeah, and is that your experience that once people are engaged, they do get a lot from it? I just note that even though the benefit seems clear, sometimes patients are nervous to meet new people or make that initial first contact.
We do try and make all the support groups welcoming and inclusive to all of our new clients coming in, and I think a lot of people do feel a benefit from attending the support groups, and I think it's really useful for them to be able to speak to somebody maybe with the same cancer or maybe going through the same sort of situations with their parents or something, and I think they do find it really useful to talk to each other. And it's all about coping strategies as well. It's about learning how to cope and deal with certain circumstances.
I guess it's just that peer-to-peer support as well. Like, if they feel feeling anxious before they get there, We have volunteers on board that will kind of talk them through it, so they're not like just thrown in at the deep end.
One thing that's very big in the cancer literature now, it's up and coming, is about rehabilitation, exercise, getting mobile, getting out there. I notice you've got some activities which are quite focused around well-being in general. Are those new, or have they been there a while?
Yes, some of the Tai Chi has been running for a few years now, but we are trying to build up on some more health and wellbeing related activities, especially for to get people from the support groups starting to undertake walking and to do yoga and meditation, and it's all part of the survivorship project, and it helps people to become independent again, so they're ready to go back into the community and live their life back to how they did live it before they had a cancer diagnosis or they were affected by cancer in some way. So it is about helping people to sort of, you know, become independent and just to improve health and well-being generally.
And who do you find accesses that group? Is it quite a mobile group in the sense that they have relatively little holding them back, or is it surprising who can actually engage in it?
We have a whole wide range of people engaging in the groups. So, you know, for instance, our walking group, you don't have to be a really good walker or fast walker to join the group. You know, it's everyone goes at their own pace. No one's ever left behind. So it's really welcoming and inclusive to everyone that we see as well.
And if people were curious about that in particular, I'm just thinking they might be worried. How far do you go? How fast do you go? What would you say to them?
You go as fast or as slow as you like, basically. You come and you do your own thing. No one will get left behind. We'll have a walk leader at the front and we'll also have volunteers at the back, so no one will get left in between. It is a go at your own pace and you do as much or as little as you like. And a lot of people, the walks usually last for about an hour, and then most people come in and have a cup of tea or coffee and a little refreshment and a little chat with the walk, after the walk.
That sounds brilliant. Is there anything you're working on developing? And also, a second question, are you looking to provide services outside of Leicester City? I think you actually do that sometimes, but tell the viewers and myself what you provide geographically.
In terms of outside the city, we have outreach groups in the different kind of counties, and they run on a regular fortnightly basis. And they're kind of support groups / kind of complementary therapy drop-in, and yeah, so they're based in the different counties.
And is there anything you're developing as a service or looking for towards putting on in the future that you think might be a new thing worth developing?
At the moment, we are looking at putting on more counselling sessions around the area. So as Nisha said, we currently hold outreach groups in Hinckley, Market Harborough, Loughborough, Leicester City, Colville and Birstall, and we are looking to do more work around Melton and Rutland, because obviously they are quite rural, and we would like to offer more counselling within those areas so people are not travelling as far. We also are looking at putting on more exercise groups around those areas, so such as walking, yoga, things like that, and we are looking at offering healthy living courses. So as of the 30th of September, we are currently running a free 12-week healthy living lifestyle course for people to attend. So we are looking at developing our services not only in Leicester City but also around the areas, and also looking at developing the services to help people become more independent quicker.
With all these fantastic things you're offering, is there are they all free for the patients if people are worried that they might have to pay, or what's the funding model?
All of our services are free, and we do ask people if they can or if they would like to make a voluntary donation. We do greatly accept donations, but other than that, all our services are free.
So that suggests to me that if people are watching this who want to support you, you might encourage them to get in touch in terms of fundraising and such like?
Yeah, we're always looking for new ideas for fundraising, or if people want to do an event that would help fundraise for us, we do have a fundraiser in post that can help you and assist you set up that fundraising event, and can help you with anything in terms of organising, getting promotional materials, collection cans, anything like that.
Well guys, that sounds like a brilliant service that you're offering, and I know, like I said at the beginning, many patients directly feed back to me that they really benefit from your services. I didn't realise myself how comprehensive your services are, so that's really fantastic to hear from you. And I want to thank you for coming in today, and thanks for telling everyone about what you offer.
Can we just say as well that it's really, really easy. If anyone does have any questions, we do have a website which is www.c-w-c.org.uk, or our telephone number is 0116 223 0055, and we always are here to help everyone affected by cancer.
And we've also got a Facebook page. Check us out.
Facebook page.
Thank
Everybody's
you.
got a Facebook page.
Yeah.
Okay.
Yeah.
Thank you.
Great. Well
Thank
done,
you.
guys. Thanks a lot.